there. Welcome to TWIRx. My name is TWIRx, founder of the Pharmacy Podcast, and I'm the happiest guy on the planet because it's TWIRx Day. It's Friday, September 26th. I need it to be Friday really, really, really bad. Just had a normal week throughout this week. I don't know how your week's been. I've been in a very upbeat and happy mood, but it was a recovery week. Just got back from 3 back-to-back conferences, the NASP, focusing on our specialty pharmacies and pharmacists. That's wonderful. Shout out to Sheila Arquette and her team. Just an amazing crew. We love that time. 3-part series is coming out. I think it starts next week. Shout out to Brady. Let us know. I can't remember exactly. Then we went to Framework LTC's Innovation Conference, concentrating on the technology of long-term care pharmacy. And that was my roots. That's how I entered pharmacy way back in 2004. I'm getting old. And we were able to bring together their partners, their clients, and really set the stage for the future of what pharmacy technology in the long-term care space is going to look like. And guess what? AI was everywhere. And there's lots of questions and confusion. And I think the element of today, which our theme today is trust, and we're going to be talking about how trust matters, who to trust, the public's perception of healthcare today. Very weird, especially just this last week. Cell and gene therapy. Cannot wait to talk to Joe today. And just a shout out to my pharmacists, my favorite providers throughout the world. It was World Pharmacist Day. Just passed, I think it was yesterday on Thursday, the 25th, and just proud to be in the industry, proud to serve. If there's any pharmacist listening right now that you'd ever like to join me on This Week in Pharmacy and you really want to dial into something that you're passionate about, please reach out to me. We would love to have you. Hey, we are going to dive in and review some news today, and I'm excited that I get to have a co-host with me. Don't usually get a co-host all the time, but Dr. Melissa Smith is not a stranger to podcasting. She's leading our pharmacogenomics podcast initiatives with her new show, which is doing very well. And I just want to say happy Friday and welcome to TWIRx.
Good morning, Todd. Thank you for having me with you today.
You're very welcome. We are, like I said, in kind of a strange land that is the United States healthcare system. It's stranger than ever. And I want to get into some news with you. So it's now time for TWIRx News. I need to have like a little voiceover that says something dramatic, like TWIRx News or something like that. So.
Yes, that would be cute.
All right. So first up, I wanted to talk about the FDA. And once again, you and I, before we are in the green room, Melissa and I are talking, and we both agree that there should be a moat, a big gargantuan moat with walls and with barbed wire guarding it. There should be an island called the United States healthcare system, and that moat protects us from politics. It protects us from nuance. It protects us from non-evidence-based. And of course, this is a fantasy land, Melissa, because we live in the real world. And so one of the questions that came up on a TikTok, and I rushed to the U.S. Food and Drug Administration's page, was what are novel drugs? What does that mean? And so the definition on the FDA's page is novel drugs are drugs never before approved or marketed in the U.S. See FDA for information about all CDERs, CDERs, approved drugs and biologic products. First of all, Melissa, do you know what a CDER is? What does that stand for?
Oh boy. Let's see here.
Because I don't know what that stands for, but they expect us to know, and this is a publicly accessible site. So I'm like, why would they say CDER?
Acronym?
Yeah.
Center for Drug Evaluation and Research.
Okay, excellent. All right, so the reason why I wanted to bring this up to our listeners is, from your perspective, because Melissa's a consultant and she digs deep into people's issues. She personalizes the medicine treatments. She hears from the physician. She grabs the football, the treatment ball, and then you run with it. But then you're making jukes, you're making adjustments, you're jumping over obstacles with the patient. And you're kind of like, I have to talk about football because football is in my mind. So I'm going to do football analogies for the entire time as Melissa's sprinting down the field with the treatment. But,
QB in this situation, right?
but talk to me about when you hear about a new drug and it piques your interest for whatever reason, especially if it impacted one of your patients, where do you go for your information to really dig into it?
Well, the FDA website is a great resource because that's where it's going to be approving newly approved drugs, but also giving us a list of these novel drugs that could be used in clinical trials, et cetera. After I go there, I go into what's available to me as far as the pharmacokinetics and the pharmacodynamics, because I am a precision medicine pharmacist. I utilize genetics to my benefit to really look at how a patient may respond to medication therapies. And what's nice about the research of bringing a drug to development is we're always going to have pharmacokinetic information. So we have insight into the CYP450 enzyme activity, other types of pathways that are going to be responsible for eliminating or activating our drugs. So for me, even if it isn't aligning per se with the research at first, I can still get some intuition around what's to be expected when the genetics can come into play with the major players that I look at every day. So that's kind of a route of attack I take in my mind when approaching new drugs that may not necessarily have all the evidence-based information there yet.
So that makes sense. And I consume information probably different than you and different than anybody because we all lean. There's people that tell me I love video. There's people that say, hey, I love reading. And then of course me, I love podcasts. I can listen, I can absorb. And then the ultimate is finding a podcast that then I can go read what they're talking about. And that kind of leads us to, once again, the theme of trust, where we're getting our information. And I really like how you said that you're going to the FDA site, but you're also looking to other, other resources. So you can kind of like that is in and of itself evidence-based medicine. It's okay. Here's the journal article on hyperlipidemia, but here's another article on hyperlipidemia, and here's another article on, and now you've kind of perused and read all three. And now as the person that's responsible for the care at the point of care right in front of the patient right there, now you get to make some decisions. And I think that's the beauty of the craft and the practice and the experience of being a pharmacist. And I can only imagine, but because I'm not a pharmacist, but is that kind of talk a little bit more about how you come to some of your decisions?
Yes, you really can't rely upon one site or one source of evidence to really make a clear determination. And that's what I was taught in school as well, is that you really have to research all avenues, all perspectives, and all things that are well vetted, if you will, in terms of what we can go off of. So for me, it's important for patient safety to really utilize all avenues at my disposal when it comes to clearly defining what a medication outcome looks like for a patient, for sure. But you also have to collaborate and speak to other people as well. You have to take in different perspectives. That's provider MD perspectives as well, because yes, they're diagnosing. They have an oversight of more things than I usually have access to when it comes to their paneling. And it's important for that to happen as well. So not only is it reading, it's actually communicating and speaking in an interdisciplinary fashion with other providers too.
I love it. Excellent. All right. Next in news, I want to share with the listeners an organization made up of originally two brothers, nerdy as hell. They're so nerdy and so fascinating and so intelligent. They're thinking like 10 steps ahead of processes. They are now funded by a bigger organization, and the name of the organization is Nested Knowledge. You can go to nested-knowledge.com. And Melissa, they're going to take buckets of data, clinical, of course, and they're going to tie it into some other databases, like maybe a Medispan or something. They're going to cross-reference articles. They're going to cross-reference other databases and EHR systems and personalized soap notes and personalized treatments. And
electronic health records too?
Yeah. And they're
wow, okay.
all together, and they're going to give it to the pharmacist, give it to the physician, give it to the nurse practitioner. And I'm blown away. So nested knowledge just like this week is crazy.
That is going to blow up the industry in a good way because there's always been a lack of communication between different EHR systems that different hospital systems use, long-term care systems use. And by able to, for this technology to allow visibility into different, I'm hoping that that's kind of the concept. It sounds like it is. That will allow for a better management overall for any patient. I'm assuming this is a technology integrated and for the practitioner to gain access to all information patient-wise, right? Is that the kind of concept here?
That's right. That's right. And it's all personalized. So, precision medicine really became a strong buzzword about 10 years ago. And then it solidified about 5 years ago. Then it really popped back up again. You can actually practice precision medicine today. And in your case, you're doing it, in my opinion, now that we have AI, if you're doing it without AI, you're doing it the hard way, even though you're still doing it and you're still doing it I would say like the old fashioned way. You're the bowl and pestle, you're grinding up the personalized medicine. But now we have AI to take all these other sources of data. And the most important one is the patient's very specific notes. But now you're combining all the specific notes with all of this trusted sources of information.
That's incredible. And we live in a very cool time right now to be able to have this integrated. This is something that when I was in pharmacy school and then early in practice, thought this was far off in the distance. Like it was a problem that just seemed impossible to solve, right? But with the integration of AI into the mix, it allows for it to come to fruition, right? So I'm excited about it. And it allows for me to be able to not have to invest so much time in the searching of information. And it can allow me to expedite my process significantly. So that way, ultimately, we're getting things out to the patient in a more effective way where they're feeling happier, healthier, more empowered. I love this.
Yeah, exactly. Exactly. And I think it's going to lead to pharmacists becoming very creative with what they dig into. I think of Daniel Plummer and the world of pregnancy and the world of getting pregnant. I think of Nadia Archambault and the way that she coaches sexual health and mental health and the fusion. And I think of Jenna Quinn and pediatric. Like you guys are all champions, and you're already these, in my eyes, you're like these superheroes. But now you're going to have like this extra toolkit to go even better and deeper and just do so much more. So yeah, I'm excited.
I like that term, toolkit. It's essential in our arsenal of tips and tricks that we pull out for us to be that much more proficient.
So if you go to, once again, nested-knowledge.com, you can get it for free. Just try it out, poke around,
Get it for free. That's even cooler.
Yeah, just try it out for free, and then let me know what you think, and then we'll get back to the Calamus brothers, Kallems, and they're just, like I said, they're dynamic, and we're going to be actually doing some work with them. And what they're going to help me with, and by the way, this stems off the word of trust, they're going to be helping me with a standard. And the standard that I've been working on since September of 2020 is called evidence-based podcasting. And what I've learned over podcasting in pharmacy longer than anyone, and observing and listening to you and learning from pharmacists and learning from even patients and physicians and putting all this together, what I've learned is that you have great respect for evidence-based cataloging, data repositories, journals, and your podcasts that have exploded over the years. When I started in 2009, there were 0. Now there's about 300 podcasts that are tied into pharmacy. We have about 42 of those. And underneath that umbrella, 0 of those podcasts are evidence-based. And that means that your podcaster and your guest and the information that you're talking about and the journal that you're reviewing and the article that you're digging into, that's well and fine. It's still opinion because you didn't give it off to two other people that have nothing to do with you. They are completely unbiased. They don't have any reason to say anything this way or that way, but they're going to critique, they're going to dig down, and they're going to call you out if you've said something on that podcast that is not truly evidence-based. And we're going to be coming up with this standard. The standard is almost complete. We're about 98% completing with the standard. Want to give a shout out to pharmacists and continuing education providers that this is going to revolutionize podcast supplemental learning. And I use the word supplement strongly, Melissa, because I still don't believe that a podcast should ever be the primary information. I think it should be secondary. And even evidence-based podcasting, when you get in your car and you're going to your treatment center in a hospital and you have a patient, it's a baby, they have this blood disorder, whatever, and now you can listen to a podcast that on the way, it's a 15, 20, 30-minute show, and it's the latest on the XYZ disorder or whatever it was. And it's evidence-based. It's been peer-reviewed. So I think that that's important in an age where Dr. Google has perverted medicine from people diagnosing themselves, and people are like, but I listened to Joe Rogan, and people are like, I listened to Dr. Oz or this podcast. And it's still not evidence-based resources. So what do you think of this concept?
I think it's important. We're in an era where information online I can't tell you how many times I've had patients use that same type of ideology of using Google to diagnose themselves and then coming into a conversation with me with things that are like just very low level of evidence or just more. I feel like whenever they go into, let's say, Google or ChatGPT, they're Googling like very specific things that they want answers to. And ChatGPT and Google are not always going to give you the most accurate interpretation of that information. So that's important. And that's where practitioners like physicians and pharmacists are so instrumental in being able to be, guiding lights to that information, because one, we've gone through school for so many years to be able to understand and interpret this knowledge for you and truly err on the side of caution for you to do no harm to you as the patient. I mean, that's the idea here. And making a podcast available to practitioners and even other listeners who just want more evidence-based, true information than just listening to some influencer online about how they should be correcting their cholesterol with this supplement over here that probably doesn't even have what the active ingredient that they're looking for in it, because nothing's being vetted that way either. So we live in a very tricky time, and being able to provide the public practitioners with a podcast that truly vets the information and only showing the higher levels of evidence that surround the different topics and conditions and medications that we're trying to work with our patients is important and truly is a big responsibility. So it takes a person like yourself, Todd, to be able to bring all like minds together in this and bringing it to the forefront and making it available.
Yes, and the fast track of all of this is we experimented with evidence-based podcasting with Eli Lilly back in 2018 when they were doing a podcast on Trulicity. Yeah, they were intense, and it took 6 months to edit and to make that podcast truly evidence-based and pulling back the information and vetting it. And then they had peer reviewers that were encouraged to review and give feedback, and we had to change a couple things. But there's no reason with technology today and what we've done that we can't do this.
Absolutely.
Yeah. So also in the news, I want to give a shout out. This comes from West Virginia News. That's wvnews.com. Shout out to that reporting. They covered the Orsini selected as a specialty pharmacy partner for Crinetics, Palsonify. I don't even know what that drug is. What is that drug, Melissa?
Statine. I've never heard of the drug. I'm going to be full transparency there. So let me look at this and give you an answer.
It's obviously for a rare disease, but I want to give a shout out to Nick Calla. He's a friend of mine from Pittsburgh, Pennsylvania. He's been in specialty pharmacy for years. He joined me on the NASP podcast while we were in Denver. I cannot wait to share his interview with you. But a shout out to Orsini and what you're doing in rare disease. I really enjoyed reading this article and understanding that your partnerships with other companies are opening doors, even though I had no idea what the drug was.
Yeah, I'm looking at it right now, and it is definitely a specialty drug for types of conditions like rare endocrine disorders, hyperparathyroidism, rare blood disorders like sickle cell disease and transfusion. Let me see here. Let's see here. Specific for it, though, it's the endocrine disorder, so hypoparathyroidism. And then a phenylketonuria, PKU, is also a treatment. And then so it's got a bunch of indications. Hematology disorders like sickle cell, like I was mentioning. So yes, it's one of those specialty medications that I don't necessarily see all the time unless I'm in those particular fields.
Yeah, that's why it's a specialty. They're building workflow systems for disease states now. And that disease state selection will then open up libraries of information and treatment protocols. And so especially is crazy. It's one of my favorite sectors of pharmacy and how busy it's become.
Yeah. And pharmacists have to be in this line of work because there's very specific pharmacists that are hired to only counsel on this medication and work with the providers on the administration, et cetera. I have a cousin that actually does that in a specialty drug company. So yeah, it's involved because it's not unique to the larger population. It's very specific.
Melissa, is your cousin a pharmacist?
She is. Yep. She's my cousin Jason. He's a pharmacist with Publix. He is kind of higher up in Publix in the state of Florida. And then she has done this work since she got out of school. And it was a long time ago when she graduated. I want to say back in 2009 is when they graduated from school.
Wow.
Maybe even a little earlier than that. So
it's cool. It's in your family.
Yes.
All right. Next up, this kind of ties us back to the word trust. And I've heard some disturbing feedback to some of the boards of pharmacy throughout the country, and how, once again, it's just doing it the way we've always done it this way. So this is the way we're going to do it. No, sir, you're not going to do it that way. You're going to follow an evidence-based medicine. Shout out to Bernadette Melnick with this book, EBP, the EBP competency book, redefining evidence-based medicine. Her and her partner, Lynn Gallagher Ford, Dr. Ford and Ellen Overholt wrote this book. And this is what I based evidence-based podcasting on, and being able to come up with a format and a standard to assure that the information that we're reviewing is in fact evidence-based. And the headline here from the Alabama Political Reporter is Alabama Board of Pharmacy faces backlash over Open Meetings Act violation. And it kind of goes into the privacy issues that had come up, as well as a settlement that's actually in place. The trust that we think as the consumer that our boards of pharmacy are assuring that information PHI is kept in place. And it's just, this is the third time in a month that I've heard from news or I've heard from a pharmacist that something's going on awry at their board of pharmacy. And that's disturbing to me because, once again, I want a common denominator. I want to hit the floor and I want to not sink. I want to stay on something concrete. And I want that to be based on healthcare trust. So the boards of pharmacy are supposed to be kind of like our police officers of the pharmacy industry and the standards, and making sure that one pharmacist to two techs, or, just the whole gamut of what comes into play. But have you ever had run-ins, either good or bad? And you don't have to be specific, but anything tied back to a board of pharmacy, Melissa?
Not me personally, thank God. But I was reading a little more deeply into this article, and it's being pretty vague about what the explicit indicate, what they're inferring as far as inappropriate conduct with the board of pharmacy members, and one in particular through this. And that's interesting that they're being that vague, right? Because it almost insinuates like a higher level corruption happening. And
True.
that's very scary, because when we have people that are coming into what's supposed to be these unbiased entities that are overseeing our practice of pharmacy in each of the states, we can have a lot of overreach in those situations, and also more of a political sense of infusing things into our practice as well. Not necessarily, I mean, not always in a bad way, but sometimes in a corrupt way, where it's more benefiting people outside of the practicing body as a whole. You know, it is scary. Me personally, no. But I mean, when I think back into COVID times, and then that going into how we were administering the COVID vaccines and the medications available then, I mean, no, nothing. I mean, outside of that, it's more of me thinking about how in a blink of an eye that we can have somebody just reach in and then really differentiate what our practice looks like. So it is scary. And you want people there that are, you know, honest people that have the best intentions when going into that particular role. So yeah, fortunately, no, but thank you for making me aware of it. I'm going to be following it a little more closely now.
Yeah. And I think a shout out to our pharmacists listening. Listen, your boards of pharmacy, I think down deep inside, they want to do what's best. I think they took those positions because they felt a pride in securing and in protecting. But they're humans just like everyone else. They have stress. They have, you know, things that are happening in their own life which may impact the job of and such. I almost think that we have to almost come up with rotations with boards of pharmacy to assure that someone doesn't get complacent as someone who's I've heard from pharmacists. There's some that are the black and white, straight up and down, really to the text board of pharmacy officer. And then the other ones,
line,
like,
yes.
maybe they're bored or something like that, but yeah. So I want to give a shout out to pharmacists listening today. Once again, it was World Pharmacist Day. Happy World Pharmacist Day to you, Melissa, and to everyone listening. You're very welcome. And then a shout out to pharmacists interested in learning more about precision medicine and pharmacogenomics. And if you don't know Dr. Melissa Smith, please reach out to her on LinkedIn. Very active, very involved, and you've helped a lot of pharmacists understand what the potential is as making a pharmacogenomics tool in their toolbox, in their belt, and really expanding upon what it means to be a precision pharmacist.
Thank you so much. Yes, I encourage anybody listening, especially pharmacists that are wanting more insight into how to implement this. I am available. I talk to pharmacists quite a bit about this because there's so many reaching out with wanting to implement this, and they know that it's going to be part of clinical practice here in the upcoming years. It's here now, but they're wanting to really champion it as well. And speaking with me is helpful. I give perspective.
That's right. Well, we've enjoyed this. Thank you so much for being my co-host today on This Week in Pharmacy. Shout out. What do you have any plans this weekend? By the way, are you a football fan?
I'm a football fan. I don't necessarily, well, I'm in Tampa area, so I'm with the Buccaneers, of course. I went to University of South Florida. They just traded divisions and they're doing well right now. They moved up in the Southeast, right? So those are typically the ones I follow.
The Pittsburgh Steelers are in Ireland this weekend, and we'll see what happens there. I don't even know who they're playing, but I'm kind of like a lukewarm fan. I watch and usually start watching a lot more seriously if there's playoffs, but who knows?
I'm kind of, I follow, but I'm not like some of my other friends that are very diehard to their different schools they went to and what have you. But what I want to do say is that I have my podcast episode airing on Monday here on September 29th. It was a great episode. I was with my good friend, Dr. Vanessa Lesneski in that episode, and we were talking about pharmacogenomics in the academics. She's actually a faculty member at the LECOM School of Pharmacy here in Florida and the Sarasota area. And we were discussing a lot of things surrounding just implementing pharmacogenomics, what it looks like for her with her students there, and just kind of the undertone of enrollment with pharmacy. So definitely take a listen.
If you would like to listen to all of those podcasts under the banner of pharmacogenomics, just go to pgx4rx.com. Once again, that's pgx4, the number 4, rx.com. And tune in on Monday for the 29th of September for the next episode with Dr. Melissa Smith. I can't wait to listen.
Thank you. I appreciate it.
All right. We will be right back on TWIRx. Don't go away.
Feeling lost with the complexities of pharmacy accounting?
In pharmacy today, there's so many different, variables and issues that impact the pharmacy books, records, accounting, the profitability of the store, so forth. There's different components of pharmacy that have its own nuances from an accounting standpoint. And so it's tricky. There's no doubt about it.
Ready to take your pharmacy to the next level but don't know where to start? Sykes & Company is here to help. Introducing the RX Assessment. With the RX Assessment, the pharmacy CPAs and advisors at Sykes will do a deep dive into your accounting and tax situation and give you the action steps you need to take your pharmacy to the next level.
If you're interested in, working with a team who understands the industry and how the accounting and tax should really be in a pharmacy, this is your chance to get a under the hood check of what's going on and getting the feedback of any issues or concerns or, again, things we think you're doing really well with.
Get the financial checkup your pharmacy needs and head over to sykes-cpa.com or call 252-482-7644.
Hey, welcome back to This Week in Pharmacy. Excited about this next segment and just getting into news of the day and things that are happening this week. We hope that you've had a wonderful week in pharmacy, and we know that there's a lot of challenges in the industry right now. We're hearing a lot from our chain pharmacists. We just got to spend a lot of time with our specialty pharmacists out in Denver. We attended the NASP. Be on the lookout. We're going to be doing a 3-part series with the National Association of Specialty Pharmacies. And then we're getting ready for 2 conferences. We're going to be going to the Explore event, which is PrimeRx's conference, and their user conference, which is going to be really exciting. It'll be in New Jersey on October 10th. And then we'll also be attending the NCPA, the National Community Pharmacists Association, the Super Bowl of all things independent community pharmacy. So I'm so excited about that. I think that's on the 22nd and 23rd. And we're going to have a show probably next week or maybe the week after that will preview a little bit about what's happening. But we want to jump back into the news quickly. I have 2 special guests. And before we welcome them, I just want to share with you news that I'm sure you're well aware of.
First, effective immediately, the FDA will be notifying physicians that the use of let's see how we say that, acetaminophen. Is that okay? Which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary. That's for instance, in cases of extremely high fever, that you feel you can't tough it out, you can't do it. I guess there's that. It's a small number of cases, I think. But if you can't tough it out, if you can't do it, that's what you're going to have to do. You'll take a Tylenol, but it'll be very sparingly.
So I want to welcome back Rob Kress, my godfather of functional pharmacy. I gave you that nickname, Rob, quite a while ago because you're a pioneer. pioneering in the world of holistic and functional pharmacy. And welcome back, Rob.
Thank you, Todd. I appreciate it.
Another hero of mine, Lauren Castle. Dr. Castle, thank you so much for being here. It's great to have you on TWIRx.
Absolutely. Thanks for having me.
All right. So I'm going to start off with Lauren, and I reached out to you. Thank you so much for making this time for us at the last minute. But just give us your feelings about this week in pharmacy, where we're at and what you're thinking.
Yeah. So as a woman, I first would have to say that I don't think we should ever have to just tough anything out. Unfortunately, in women's health, that sentiment is way too commonly expressed. And so this whole discussion really brings up an important point, which is research in women's health, research in pregnancy, research for children, right? Normally, we're all about saying, yes, we need more of that. But in this particular case, when the administration is actually saying, we need more of that, the established research that's out there is pushing back and saying, no, we don't, because we've already established that Tylenol is supposed to be the safest choice for pain and fever in pregnancy. So we're getting kind of two conflicting narratives, when really the truth of the matter is it's not an either or situation. This is a both and, right? We still know that, yes, Tylenol is the safest option for pain and fever in pregnancy. And there may be more data that we don't fully know yet on how this could potentially contribute to conditions that are being explored. So if you're a mom, if you're a woman, if you're listening to this, right, number one, we don't want anyone feeling shameful about if they've used Tylenol or if they're going to need to use Tylenol, because that's not the point here. Where we actually are all agreeing, and I think this is what is important to really focus in on, both President Trump, the FDA, and even groups like APHA and the ACOG all are saying, and I'm reading this from the ACOG website right now, judicious use at the lowest effective dose for the shortest duration necessary in consultation with a OBGYN or other obstetric care professional. I would add pharmacist into that, absolutely, because we know what medications are safe or not safe for pregnant women. That's a key part of our training, remains consistent with best practice. That is exactly how I still feel, even using my own functional medicine lens, the master's program that I went to, all of these things, we're not disagreeing on that. Acetaminophen should be used at the lowest effective dose for the shortest duration necessary. That's still the bottom line. And so to me, when I think about how I would talk to a pregnant woman who comes to my counter and is saying, I have this headache, I'm really not sure what to take, I'm pregnant, what should I do? A lot of pharmacists would, based on our training, just say, oh, you can take a Tylenol because that's the safest dose, right? Don't take aspirin, don't take ibuprofen, just take a Tylenol, that will help your headache. In the functional medicine world, the first answer is not going to be, oh, you can just take a Tylenol for your headache, right? And really, in conventional pharmacy, that also shouldn't be the first answer, right? Headache is a really common sign that something is wrong, whether it's dehydration, electrolyte imbalance, or worse yet, an early sign of preeclampsia, right? If a pregnant woman comes to me and says, I have a headache, I'm taking her blood pressure immediately, right? So I think this is the most important part of this whole conversation, is that we need to be stepping up our game as medical professionals, no matter what side of the aisle we're on. Yep. It's really about taking care of the patient that is in front of us at the individual level, right? Yes, we will still have Tylenol as our backup medication if we need to use it, but I would like to see this whole conversation really push us that much further into truly looking at the patient and looking at all of the non-pharmacologic options that we have to treat pain, fever, headaches, all the typical things that Tylenol is used for. So that's my take on it. I made a post on Facebook and LinkedIn, and I was really shocked that it was shared like 50 plus times. And by and large, by women who were also saying, yes, like, thank you for this. This makes so much sense, right? This isn't an either or situation. It's how can we actually use these medications safely? And how can we leverage all of the other amazing potential solutions that we have before we get to that point of needing medication? And I think that's where most pharmacists stand.
Love it. Rob Kress,
Yes, sir.
my functional pharmacy godfather. Welcome to the show. It's so good to have you. Yeah,
Thank
give
you.
us your input, because you and I, you had jumped on an Instagram that I posted from Mark Garofoli, and I always value your insights. And if I could put a Brady Bunch panel together today where I had like 9 pharmacies all in a circle, that would have been my preface. But it was a blessing to get you on at the last minute. So thanks for being here.
No, I appreciate it. Appreciate it. So, you know, and even in regards to that, because it's funny, I'm not one that gets traction on social media, but my God, the last few days. So this is obviously a hot button in a big way. So I'm grateful that the conversations come up, right? I'm glad that it was probably Bobby Kennedy that brought this to the forefront. And I think he did it rightfully so, because I think the problem we have in our training and in our country and in our medical system is a casual use of over-the-counter and prescription medications. Because the guidelines that Lauren just shared, few people practice in that. And it could have to do with, it's a busy day, we think it's safe, but you can give it, say if we're talking about pregnant women, you can actually give it judiciously in someone in front of you. But what we're not talking about, because medicine is not black and white, we live in a big gray area. And what happens when they go home? What happens with the use of acetaminophen there? Because we know the problem is, and this is one thing I wanted to bring up, is it creates a metabolite in our body that chews up this master antioxidant called glutathione. And if we want to bring the name of autism into it, there are some studies that will show that some autistic people do have low glutathione levels. Now, there's also studies that show some don't, right? So that's one thing. And I had a lot of people shoot me studies. And I want to talk about that as well, because we really shouldn't work off of individual studies. That's the beauty of a meta-analysis, right? We're bringing a whole bunch of people into it, and population-based studies. But once again, in every one of those, it's never your patient. So there's so many other variables that can affect it. So I think the importance of this thing is the conversation came to the public. I've had a lot of people, even on my TikTok, tell me the issues that they did have during pregnancy with Tylenol. So a genomic component can come into play, right? Their mitochondrial insufficiency or sufficiency come into play. We could probably connect the dots with hypothyroidism. So I think the important thing is not to say it's safe. And that was my thing with your post. I don't think anyone can conclusively say that. That's a generality. But we owe it to our patients and even into ourselves in our own individualist practice, when we want to put the patient first, to look at everything and look at alternatives and options. Like, how many people that go to medical or pharmacy school or whatever know an ounce of nutrition? How many know that they can actually recommend or learn about homeopathy, which is approved by the FDA, which can treat pain, which can treat fevers? And then the other thing is, how many people are educated on when they really need to treat a fever, right? A lot of times we have a knee jerk in our society. There's a fever, give them something. But that fever, it has a biological purpose. And yes, it can get too high and that can be dangerous. So I think there's this proper education, one for practitioners, and to convey that to the patients that needs to be had as well. So I think all this brings upon a critical, holes that are in our system on how we can progress better.
So just the both of you, just to understand from my perspective, I'm the consumer in the group. You two are the doctors. So I'm definitely going to take your advice and take your individual device based on me compared to someone else, right? And obviously talking with my physician. But that's not our public today. Our public has been conditioned to knee-jerk react. Our public has been conditioned to take a pill for anything and everything, and it just magically, is supposed to make you better. Why isn't this working? Why isn't this, specific medication working? Maybe it's because you're not eating right, or you're drinking too many sodas, or something else is happening, that it's not all about just taking a pill and being done. And then now add in the hypersensitivity around mixing politics with evidence-based medicine, with people who have degrees, with the combination of, but I read on Google, or I read on TikTok, for God's sakes, or so the public is just in such a different position than when I was growing up, where he had the newspaper, for God's sakes, or a shiny looking magazine. And now information is so quick. And then there's the world of the chat bots, and there's the world of the clickbait, and then there's the world of getting people's attention. That makes your jobs, Rob and Lauren, so much harder. And I can only imagine the physician after they saw this. So my point, beyond taking the post of a pharmacist and reposting it like I did through Pharmacy Podcast Network, is and why it's so important to have multiple input, is for us to slow down as a profession first and saying, how are we going to get ahead of this? As a matter of fact, the APHA put out a public statement, then it was a blanket statement, which in my opinion, that's a mistake. They said right out, hey, acetaminophen's absolutely fine. This is great, blah, blah, blah. And it was kind of just a black and white statement, which is nice because you do want simplicity. However, the both of you are semi-contradicting, where you're saying it's individual and we have to really take blood pressure, like Lauren just said, and kind of get some factors into what's the headache, what's really happening, rather than just quickly taking a pill, quickly taking something, expecting that it to be okay. And then it's even more complicated because now it's a pregnancy, and you have another life that you're thinking about. And so, wow. But my point, becoming the consumer and not the PharmDs, and certainly not the MDs, as I stand back as I would consider myself a little bit more of a educated consumer, is number one, I know how to say acetaminophen or hyperlipidemia or pharmacogenomics. And it took a long time to get like that. There's the Volibanabs that I cannot get out. There's like 6 or 7 NAB drugs. I can't say them. But my point and my irritation was President Trump and his administration and Bobby Kennedy, they know what I just described. They know that there is a heightened level of political sensitivity. They know that no matter what some of the administration says, that the opposite of what that of those people, like on the left, for example, is going to just, no matter what's being said, they're going to get all upset and blah, blah. So it's the poise and the way something is being said to the public that I have the biggest problem with. And that is, instead of being a square and pounding a square peg in a round hole, which is President Trump's, that's his whole, he's just constantly pounding stuff, just bah, bah, bah. Like if it were polished and you looked at the camera and you're like, hey, listen, interesting study coming out of Harvard saying that autism could be linked in some cases with acetaminophen. We're going to be looking into more of this, but we'd like to give the public, based on H Health and Human Services, just a warning that we really want you talking with your pediatricians. We want you talking with your physicians. We want you talking with your pharmacists. But here's what the studies, here's why we're saying this. Rather than coming, at the camera and you're just like, acetaminophen will kill you and your baby's gonna die. Like, it's just like, there's a poise that really irritated me as a consumer, and saying, why did he say it like that? To the point that everybody that hates you now hates you even more than they hate you, and they disrespect you. And then the keyboard warriors start going to town about he's full of crap and blah, blah, blah. And then now it's just creating, like, we didn't need any more public distrust of Health and Human Services or big government, or I mean, goodness gracious, and now here we are. So that's my point.
Todd, when people watch this back, they literally should take the sound clip of you articulating this, because you did it perfectly. You really did just now. Like, if they could have just aired that clip, everyone would have been fine. This whole thing was like definitely very politicized. And again, that is where the harm happens. And honestly, at the root, I think that is what all of these different organizations are truly upset about, right? We can come to the table and we can have discussions. And I do think that the letter that they came back out with, again, after the fact, sort of hinted to that this is the precautionary principle, right? We're trying to avoid using acetaminophen if it's not needed. And maybe to their, in their minds, it was being used more than it should be. We don't really know for sure, but hopefully everyone can kind of take a step back, take a breath, and just, again, try to find the middle ground in this, which I think is where the truth really lies. No, these were not necessarily new studies that they were quoting in this FDA article, but that doesn't mean that in the future we won't have more studies. So I think for us, when we're thinking through the functional medicine lens, we're trying to understand the mechanisms behind how this might play a role in it. Even if we don't have concrete studies suggesting beyond a shadow of a doubt that it is, if we're thinking critically into the mechanisms, then that's where we can say, okay, let's just use the safest options possible. And as pharmacists, we know that can be non-pharmacological first, and then using medications appropriately when they're actually indicated.
Love it.
Let me be the devil's advocate.
Yeah, come on.
Because all conversations need that. So, it's really interesting. And I thought that because, eloquent he is not. And Bobby Kennedy probably, I will say RFK Jr. is probably more well studied on medical literature than most doctors, pharmacists, practitioners out there. Most people read headlines and the abstracts. This guy dives into it. He has brought decades of information that's already been out there to the forefront. No one else has done that. So now he brought it to a bullhorn. So the fact that we're in the spot where this information has come to life, Kay Corpus and I, we don't recommend Tylenol in our practice. We never have. Like, it's always been off the table unless it's absolutely necessary. But even in that, we seek for alternatives. So this is not new information. Yes, these studies are old, but they've never been shared on a large platform. Now, as far as Trump, I was kind of wondering this because, I cringed a little bit the way he was saying it. And the results, though, I wonder if it was like Oz talking about it. Would it have gained any attention at all? Would it have been this nice, passive, quiet letter from the FDA that any practitioner, it's no big deal, right? So as divisive as it probably has been, and as there has been harm from it, right? Because there's been some not smart people down a bunch of Tylenol and ending up in the emergency room who are also pregnant to try to combat that. That is not his fault, but it does come as a reaction to it. And I think that speaks of really the environment that we're in. And it's been a divisive environment. So I don't know where I sit on that, honestly, because I don't think it would have gotten the necessary attention that it needed. Because Bobby will be there in front of the Senate and he'll talk all this stuff. But has it gone anywhere? No. Mm-hmm. Like, I don't think, they talked about Hep B taken off of it. Thank God. Mm-hmm. Right. And if he didn't say that then, would people even know that? Like for an infant and a newborn. So I hear what you're saying, and it puts the hair up on most of our necks. And, also to speak to the point, Lauren, you're absolutely right about people feeling shamed. And I think it's great that because no male has empathy, no male can be in that position. So we can't speak to that. And the funny thing was I talked about that because we all have our things that we react to, and it's not to disqualify it, but lately I've been coming to face with a lot of mine, like defensiveness, right? And the stories that I create, and it's never that person attacking me, right? It's me and my story. And I'm not saying that's what it is. Could have been done in a much more eloquent way. I wonder if we could have brought it to 60%, right? Make it seem impactful and major, so it woke things up, but not so much, I wouldn't want to hear Oz say it. I think it would have gone nowhere.
It's a good point of communications. And I want to give a shout out to our pharmacists, our future pharmacists. I'm going to be attending my fourth time going to WVU School of Pharmacy on Monday. And I'm going to be spending time with pharmacy students, and it's the P3s. And I'm constantly going over the importance of communication, social media usage, constantly writing, keeping the writing going, keeping their opinion going, getting themselves out there. That communication is such a critical part of what is trust in healthcare, and who that trust is coming from, and how vital it is that pharmacists can be that barometer regardless of the political surging of the tides and what's going on. And that's why I love what I do, because I feel like I can always run to LinkedIn and put in a keyword, and I have a first connection to a pharmacist that knows exactly what's going on in sickle cell disease, and what's, a hyperlipidemia or something in pregnancy or something. And then, Lauren, your work and digging down into the holistic medicine and taking your own time to build an entire association to support other pharmacists that want to go in that direction. And we have a whole podcast by Dr. Marina Buskov that is nothing but holistic discussions, and she goes super nerdy deep into the weeds. And I absolutely love listening to pharmacists. I don't understand necessarily all of it, but I love listening to practitioners and providers talking to each other. A shout out to both of you. I'm not sure if the listeners know Lauren, but I want you to take a look at drlaurencastle.com. Once again, that's drlaurencastle.com. That's the website that it's a gorgeous website, by the way. I've looked through it. I think it presents a lot of value. You're also doing some retreats. Talk to our listeners about some of the things that you're doing for the education of other providers in holistic and in medicine that you're working on.
Sure. So yeah, that's my personal website. The other website you might want to check out, and that I think would be more relevant to this conversation, is actually the one listed in my little subtitle, which is fmpha.org. So that's the Functional Medicine Pharmacist Alliance. And that organization, I started out as just a Facebook group back in 2017, and then we formalized our organization in 2020. We have a membership. We're an interprofessional partner with numerous functional medicine organizations, and we're also working on some cross-functional partnerships with several pharmacy organizations. But the key thing that we offer is our Functional Medicine Pharmacist Bootcamp. So if you hear Rob and I talking about functional medicine and you're wondering what this is and how to specifically do it as a pharmacist, we have a 10-week program that will walk you through every step along the way before you need to go out and spend thousands of dollars on certifications that take numerous years to complete. This really sets you up with the business plan from the beginning to understand how to apply functional medicine in pharmacy practice. So our fall cohort is enrolling, and we'll be closing enrollment on Sunday, the 28th. So if anyone is watching this weekend and would like to be part of it, please just reach out to us and we'd be happy to get you started.
Thank you so much. I also want to mention Rob's environment. I've been watching you for years. I can't believe it makes me feel old that I can say 12, 15 years ago, and connecting with you and watching your services grow. But if you go to robcrest.com.
Nope, that's not it.
Oh, that's not it?
Functionalpharmacy.com.
Oh, functionalpharmacy.com. You guys got to update your SEOs out there. Functionalpharmacy.com.
I was like, wow, I still have that thing out there?
Yes, you do. Yeah, it's the world of SEO. I tell you what, shout out to Josh Parastani that helps me with mine and keeps us up to date at this point. But yes, just a shout out to our pharmacists. It was World Pharmacist Day this week. So proud of pharmacists and what they're doing on a global scale. Shout out to the FIP, the Federation of International Pharmacists. I can't wait to go to one of their events. And you know, I just want to say thank you to both of you for acting. I just for people's sake, it's a crazy Friday, and Lauren and Rob I text them both and got them on immediately. And thank you so much for being on This Week in Pharmacy.
Todd, can I mention real quick?
Absolutely.
Yeah. So if you go to functionalpharmacy.com, you know, Lauren and I work together on all this, and I do have a program also called Beyond the Labs, because if you can't tell, like, my thing is labs don't lie, but they never tell the whole story. So, you know, working with pharmacists on the implementation role, the coaching, and how to really expand, implement, and elevate what they're doing. And the hugest passion of mine right now is men's health. Physical, mental, emotional, spiritual, and what's going on there. So the Midlife Man Collective as well. I'm working with male and female pharmacists one-on-one to really step into this area of men's health that is sorely needed. So,
excellent. Thank you for that. Thank you so much for that. So in the show notes, there's going to be the updated links to both Lauren's connection as well as Rob's connection. I'm also going to put in some of the LinkedIn connections so that other practitioners, other providers can reach out to you. Lauren and Rob, thank you so much.
Thank you.
Thanks, Todd.
All right, we will.
This episode is sponsored by Independent Pharmacy Cooperative, widely known as IPC. Established in 1983, IPC is the nation's largest group purchasing organization owned by independent pharmacy. With a mission of maximizing the success of community pharmacists, IPC works to provide members with access to effective programs and services designed to enhance profitability for independent pharmacy. Read more about our mission by checking out our website at ipcrx.com. That's ipcrx.com.
Hey, and on This Week in Pharmacy, special guest. And before we introduce him, there have been several instances where I travel the nation for different conferences. We just got back from the NASP, the National Association of Specialty Pharmacy. We will have a three-part series coming out. I think it starts next week. And there's just a packed full of information, and how many times the topic of how will artificial intelligence be leveraged into pharmacy operations, into workflow, into therapeutic data interchange, decision-making, into prior authorization and insurance debacles, and the confusion that can drive based on some of the PBM differences and tries. And so what's important to us is to constantly come back to topics that we just don't think are getting enough discussion. And we hear from pharmacists where they'll ask me, the non-pharmacist, the talking head of pharmacy, hey, what are you hearing more about cell and gene therapy and the advanced studies and the advanced research? And I am lucky to have this show and to have this platform because we attract the best of the best in our industry. And I'd like to welcome back, I think this is his third time on the shows, and a mixture of different shows, Mr. Joe DePinto with McKesson, head of Cell and Gene Advanced Therapies. Joe, it's so good to see you.
Hey, Todd. It's great to see you. Thanks for having me.
Absolutely. So just in case people haven't heard you, you've been on our Sembia shows, I think twice. Tell us who you are. What are you kind of overseeing through McKesson's ventures into cell and gene therapy, and why are you so passionate about this?
Yeah, Todd, thanks again for having me. My name is Joe DePinto. I'm the head of Cell, Gene, and Advanced Therapies at McKesson. I've been here now. I just celebrated my third anniversary, and I joined 3 years ago to build out the vertical for McKesson in cell and gene therapy. As you said, the science is so exciting here, right? It is game-changing for patients. There's no doubt about it. Our ability to understand the human genome and cells and the microenvironment has produced great outcomes for patients. And now, how does McKesson and our vertical, which we call InspiroGene, help our biopharmaceutical manufacturers, providers, as well as payers and patients navigate the complexity of the commercial value chain for cell and gene? And that's what we do at InspiroGene. So that's what I've been here doing the last 3 years. It's great to be so close to this high science work, and it's really fun to help see patients get access to this groundbreaking technology.
Joe, are there any specific disease states that stick out to you in the you parallel the world of specialty, you parallel the world of rare disease? Is there anything that sticks out to you with regards to success or outcomes or studies around a specific condition?
You know, when I think about cell and gene advanced therapies, it's still very nascent. It's in early days of this area, but it's been focused predominantly on heme malignancies as well as rare diseases. And that's the focus that we've seen, both malignant heme and non-malignant heme, as well as rare diseases. But what's really exciting is when you look at the clinical research in the later phases, now going to autoimmune disease, diabetes, larger patient populations, really taking a look at that research moving from clinical phases to commercialization eventually. It's really important that we get it right regarding the value chain in the rare disease space, as well as the heme malignancies and some of the non-malignant heme, so that when these bigger indications come out with a lot more patients, bigger patient population, that we really understand how this all scales.
So just this week, if you've been paying attention out there to the news wires, it says this week's Biopharma News Phase 3 trial for Parkinson's disease in cell therapy, and this news is coming out of Europe. And it's exciting to see for what we would consider behavioral health and in senior care, and how that collides to pharmacists understanding what that means and then where the option is. And Joe, explain to the listeners where that gear gets shifted from a traditional pharmaceutical product to a cell and gene therapy product. When does the physician, pharmacist, nurse, practitioner care team say, hey, can we try this here?
You know, you said the key word there, care team. And it's really important when dealing with the complexities of cell and gene therapy that it's just not one stakeholder here. It's truly an interdisciplinary team. It can be everything from the pharmacy, coordinating with the cell lab, coordinating with the service line. You saw Parkinson's disorder there, neurology, right? You have also oncology. It's really understanding the intricacies of patient identification, appropriate patient identification, qualification, benefit verification. All of that works as a team to deliver these products. It's not linear. Sometimes it's circuitous in nature, but it really is very team oriented, the approach to treating these patients. So you nailed it when you talk about the treatment team.
Yeah, and as we just started before introducing you to the TWIRx listeners, we were talking about the NASP and how many times while I was there, of the 30-some guests that we talked to, probably a third of them chimed in to artificial intelligence and how AI is being leveraged. And it's not imaginary anymore. It's not what might be coming. It's what's being used today. And there's an article that just came out this week, and it says AI transforms cell and gene therapy manufacturing with real-time insights. What aspect of artificial intelligence are you excited about, Joe, inside the bucket of cell and gene therapies?
Yeah, so what you're pointing at there is clearly a barrier that has been a challenge for many manufacturers, is the complexity of manufacturing some of the cell and gene therapies and looking at how do I optimize the time to delivery of these products? How do I make it more efficiently? How do I get quality products to the right patient? We track and we trace it appropriately, especially if it's a specific autologous or matched product that needs to go to that specific patient. So using technology here is a common theme to overcome barriers. And look, if we're going to scale the value chain in cell and gene, it needs to be done in a combination of intimately understanding the core different components of how these products get delivered. And that starts with the manufacturing process. This is not made all the time the same way. If you've seen one cell therapy, you've seen one cell therapy. Gene therapies get made differently, right? So using technology like AI, and I see a lot of activity in AI, and I'm excited about it, but I'm also curious to see how this is going to continue to evolve, because it seems to be evolving weekly at this point. Look, if we can if we can overcome some of the barriers to access through technology, I'm all for it.
Absolutely. It is. It's like as scary as it is exciting sometimes when you hear what AI is doing. And as long as we don't lose the physician's oversight and the pharmacist input, I'm all for it. Gene and cell and gene therapy. I've said I'm intertwined and been corrected in previous conferences, Joe. So I have to be careful that the gene comes after the cell. And if you go to Google and put in cell and gene therapy, McKesson, you're going to pull up the very first landing page is the Inspiro Gene by McKesson. And it's an incredible site to answer a lot of your questions. If you're listening, if you're wondering about specialty distribution or specialty pharmacy in general, and you want to just learn more about what McKesson's doing, what excites you most? Let's say, like you said it best. It's week to week that things can change, Joe. But what's exciting? What's exciting to you being part of this McKesson team as you're leading cell and gene therapy?
So I like to think of this time of year as the season of cell and gene therapy. And the reason I say that is we're coming up against so many important conferences like the Alliance for Regenerative Medicine that's happening in the meeting on the Mesa in Arizona next month. And you have a lot of different value conferences around value-based care in cell and gene therapy. So there's a lot of activity in the space. The space continues to evolve as the science evolves. So I'm excited about how, as a industry, as a cell and gene therapy ecosystem, we can all get together to talk about how, through cooperation, collaboration, we can all work together to overcome some of the complexities of the value chain and complexities of patient delivery of these products. Because, look, the science is unparalleled in many instances. It's great to see the success scientifically. We now need to start to accelerate the commercial success. And that can only happen through collaboration of the entire ecosystem, the providers that are deciding whether or not those patients get the products, the sites of care where they get the products, the manufacturers who are going to manufacture the product and make sure it gets delivered, and the payers who ultimately pay for the products.
All right. So we know of pharmacists who have wonderful relationships with their physicians. I think of Jenna Quinn in the realm of pediatrics, and she was always squawking back to the pediatrician just to give them a heads up of what's going on. There's going to be pharmacists out there who are nerding out on cell and gene therapy and really going to like the advancement and the technology. What's your advice to pharmacists to, number one, learn more about it and its application, and number two, how to be more collaborative with the physician leading the parade?
You know, we talk about that a lot when we think about some of the barriers for commercial adoption is the referral process. And when you talk to sites of care as well as clinicians and pharmacists that do that well, it's always about having a strong communication and referral process. That it's just, you don't throw literally or figuratively throw the patient over the fence and refer them. It's that constant collaboration, conversation around the appropriate patient as a target for a specific product, and that patient has a good understanding as well as the pharmacist, the caregiver, the whole team, right? So appropriate communication is really important there. And it helps in the referral process, because if you look at some of the data in cell and gene, some of these patients may not sit locally where the sites of care are, right? So it's important to do that. One of the pieces that we've developed at Inspiro Gene is our Inspiro Care Hub. And that hub is a little different than the typical hub. It really acts as like sort of a case management component for the providers as well as the patients, their caregivers. And it helps them manage the complexity of navigating patient access, everything from benefit verification to a coordination of delivery of the product and communication. The more transparent and communicative we can be, I think the better off everybody's experience will be.
Agreed. If you would like to learn more, go to inspirogene.com. That's INSPIRO gene, inspirogene.com by McKesson. We're going to have a link. If you're driving, if you're walking, you're doing something you can't see, don't worry. There's going to be a link in the show notes as well as a link to Joe's LinkedIn. Joe, this has been wonderful. Really enjoy the insights. You're constantly giving us new information. We appreciate that. Thanks for being on This Week in Pharmacy.
Thanks, Todd.
Hey, we'll be right back with more TWIRx in the works.